My name is Dennis DeGennaro, and I'm here to talk to you about multiple sclerosis, or MS. The following is a story about a woman named Chantel. Chantel lived a relatively normal, happy life. She then started experiencing things like memory loss, vision impairment, hearing impairment, uncoordinated movement and balance issues, lethargy, difficulty with fine motor skills, numbness, and full body pains. Eventually, she went to a doctor and was diagnosed with MS in 2014 after the birth of her son. Multiple sclerosis, or MS, is an autoimmune disorder that affects the central nervous system. In people with MS, the body's immune system attacks the insulating layer that surrounds nerve cells, often killing them. It is an awful disease that affects roughly 2.8 million people and has no cure. These are the 4 stages of MS. CIS, or clinically isolated syndrome, is not really technically MS, but it is an early onslaught of it, and 63% of people with CIS eventually go into stage 1 of MS, which is RRMS, or relapsing remitting MS. This is the most common form of MS, and 1 million people affected have it, and this is approximately 85% of MS patients. Following that, you get into primary progressive MS and secondary progressive MS, which are far smaller in terms of population percentage, but still make up a substantial amount of people, as you can see from hundreds of thousands of people being affected. While this is bad, there is a treatment that is effective at limiting the spread of the disease and lowering relapse rates. Enter Ocrelizumab. Ocrelizumab is currently the only approved disease-modifying therapy, or DMP, for primary progressive MS, which 400,000 people have. It can also be used to treat RRMS, which 1 million people, including Chantel, have. In recent years, scientists have learned that B cells, a key aspect of the body's immune system, play key roles in MS pathophysiology. Ocrelizumab works as an antibody that attaches to certain markers on B cells. It then selectively depletes these B cells, thus reducing relapse rates and delaying the worsening of disability in patients with PPMS. Anti-B cell therapies like Ocrelizumab serve as a breakthrough as clinicians strive to mitigate damage and prevent blindness and loss of coordination in patients. Taking the IV once per 6 months can vastly improve quality of life for MS patients. Furthermore, clinicians have struggled with predicting the course of MS and accompanying medicines. Therapies like Ocrelizumab have an 80% efficacy rate, preventing the worst for the majority of patients and allowing many to have the same quality of life as people without MS. Ocrelizumab's brand name is Ocrevus. It has to be taken once every 6 months and is not an over-the-counter treatment. It is administered via IV infusion. It can be administered at an infusion center, the doctor's office, or even your own house, depending on what you and your doctor think is right for you. If you wish to receive this treatment after confirming with a health inspector that it is right for you, then call the Ocrevus Patient Navigator at 1-844-OCREVUS or 1-844-627-3887. Keep in mind, however, that Ocrelizumab is by no means a cure, but it's rather a therapy that increases MS patient lifespan and comfort. Since it targets the immune system, the patient's immunity is weakened as a side effect, and some patients may experience headaches, nausea, common colds, etc., etc. So it's not a cure, and there are some side effects, and as amazing it is, it's merely a treatment, not a cure. But while there are no cures to MS right now, that may change soon due to a discovery in the field dubbed Runner-Up Breakthrough of the Year by Science Magazine, which is related to the cause of MS. This is the Epstein-Barr virus, which was discovered by scientists Epstein and Barr. Epstein-Barr virus is a common herpes virus that infects humans and is associated with causing infectious mononucleosis and various other illnesses. However, what we care about is the fact that researchers have discovered a link between people that have this disease and multiple sclerosis. Most notably, researchers calculated that people infected with EBV were 32 times more likely to develop multiple sclerosis than those that did not have the disease. This is the first time anyone has shown rather definitively that a virus is the trigger for multiple sclerosis, MS expert and neurologist Lawrence Steinman said, and these exciting findings open up some new directions for clinical trials in MS treatment. Despite the recent breakthrough, however, Steinman believes that a cure may still be far away. In a 2023 interview, Steinman said, "It does take decades to take a good idea and prove it in the clinic due to a variety of logistical errors." With that in mind, research into MS development will still continue in order to make life better for the millions of people with stories like Chantel's. For now, we have anti-B cell therapies like Ocrelizumab, improving MS patients' quality of life and paving the way to the future. I'm Dennis DeGennaro, and thank you for listening.